How much longer will we be watching news through tears as gun violence continues as a healthcare issue? Hello, I'm your host, Dr. Maurice Pickard, and you're listening to Clinicians Roundtable. And with me today is Dr. David Fleming, President of the American College of Physicians, the nation's largest medical specialty organization. He is also Professor of Medicine at the University of Missouri School of Medicine. Thank you very much, Dr. Fleming, for joining us today.
Well, it's my pleasure. Thank you.
I know the American College of Physicians this year has come out with a recent policy paper on firearm safety and regulations. Could you tell us briefly about it?
Yes, this paper came out in April of this year, and really was a new policy paper that offers several strategies to address the societal, healthcare, and regulatory barriers to reducing firearms-related violence, injuries, and deaths in our country. We approached this in relation to what we felt was a public health issue, so that any policy decisions would be based on scientific evidence. Our clinical guidelines and any of our policy papers are evidence-based, and we tend to do a deep dive in what data is there and the appropriate information that needs to be shared that policy can be based on for the good of the public.
You know, you can't open a newspaper nowadays without seeing an opinion poll on how the American public feels about gun control and gun issues. How is this different, and how will it be more helpful if we can rely on research rather than these very positive opinion surveys?
Well, you know, one of the problems with opinion surveys is that they are opinions. These are very oftentimes strongly held opinions by those that are being asked the questions that are out there, and they can be quite varied, very polar, in fact, which the issue about firearms and firearm safety can oftentimes be, as we have seen. We find that when we base our decisions and we base policy on subjective evidence, which is opinion and anecdotal evidence, that oftentimes it doesn't quite capture really the areas that are universally important in how we approach particularly public health issues. It's extremely important, we feel, that we look at objective evidence that is in place. Although anecdotal evidence can be, and certain cases and experiences that people have can certainly be informative and help to inform any decisions that are made, it's really important to look at what the facts are. Because if we don't make decisions based on facts, then we tend to actually steer policies in directions that may not actually be addressing the issues.
Well, our audience is almost entirely physicians. And what kind of published evidence can they go to? This cause, effect, and prevention.
You know, there's a great deal of published evidence in the public health domain right now. And in fact, our paper, which was published in April of this year, really reflects on a great deal of that in terms of what can be helpful, what can be useful, and what actually has been successful in the past in dealing with these kinds of issues. And I would suggest that any of the public health papers or data sets that are there are areas where they can probably get the information that they need.
Well, in 1996, the American College of Physicians had a policy paper on gun safety. Not a lot was done about that policy statement. How is this one different?
Well, you know, the mass shooting that occurred in December of 2012 at Sandy Hook, which left 6 adults and 20 children dead, and other mass shootings that have, been seen in the news, quite tragic over the past several years, have really brought firearm violence to the forefront, really in the national discussion. And over the past 18 years since our 96 paper was written, the college has felt that it was important to really review the available evidence and update its policy in an evidence-based manner. This was sort of a wake-up call for us in looking at these tragedies that were occurring, to look at the evidence and to see where we have been. Is there anything different now that was different at that time? And to really see if there is a way we needed to approach this differently than we had. And what we found that really many of our positions were reaffirmed. We also found that there was evidence in support of the effectiveness of assault weapons bans waiting periods for concealed carry laws, that we needed to enhance that. We felt that it was important that we try to address the issues of concealed carry because of the safety concerns that were out there. Although we support these measures, we also acknowledge that more research is needed. I mean, what we found is that the data is not as good as we would like for it to be. The new paper that we have published also includes recommendations on mental health. It's in opposition to state or federal mandates that interfere with physician-free speech in the physician-patient relationship. We feel that physicians should, indeed, have an obligation to talk to their patients about safety issues in the home at every level, and that includes firearms.
Although these mass, terrible tragedies have caught the nation's eye, statistically it appears that most deaths from firearms are unintentional shootings and suicide. So what can the doctor in his office do about that? It's unlikely he will stop the things like in Aurora in a movie theater. But what can he do about these unintentional shootings?
You know, it's interesting. I think the comments that you make are accurate. In fact, I've got the data right here in front of me that the homicides by firearms result in about 11,000 deaths each year, but more than 19,000 firearm deaths are by suicide. And the number of non-fatal firearms injuries is more than double the number of deaths. And it's estimated that nearly 74,000 non-fatal firearm injuries occur in the United States, and this was back in 2011. And the data is probably fairly accurate today in terms of the number of injuries that actually occur. So the evidence does suggest that firearm availability does increase the likelihood that a person will be killed, either by homicide or suicide, when firearms are available to them. Versus those situations where firearms are not available to them. This is similar to talking to patients about seat belts, talking to elderly patients about taking safety measures at home so they don't have loose carpeting that they may slip on, so that they have handles to hold on to when they're using the toilet, things along those lines. These are safety precautions that we feel are important to ask patients about. And we need to recognize that firearms are also used in the community, and they're used for sport, they're used for recreation, indeed they're used for self-defense. And we support and recognize the constitutional right for that, the Second Amendment right for that. But the paper doesn't really go after that particular area. What we're addressing are the health concerns, the health issues. And we feel that there is more that certainly can be done along those lines.
Well, it certainly sounds like when a doctor says, I'm not anti-gun, I'm pro-gun safety, this is really the forefront of what your organization is saying. If you're just tuning in, you're listening to ReachMD. I'm your host, Dr. Maurice Pickard, and joining me today is Dr. David Fleming, president of the American College of Physicians. Today we're discussing what can be done to improve gun safety. A issue that certainly is on the forefront of the newspapers is the inability of Dr. Vivek Murthy to become Surgeon General. In 2012, this doctor said, quote, guns are a health care issue, unquote. Well, they are. What can doctors do to get Dr. Murthy or somebody who has the same feelings to become our Surgeon General?
Well, the college does strongly support Dr. Murthy's nomination. He's a strong advocate for increasing access to health care. He has a strong track record in that regard. He has extensive experience in public health. He also happens to be a member of the college and is an individual who clearly is very bright. He's well educated, and although young, has already shown a substantive degree of strong leadership in areas that relate to public health, just based on the policies and practices he has already put in place for what he has done. In terms of physicians supporting an individual like Dr. Murthy to become the Surgeon General of the United States, or any other individuals who are going to be in leadership positions where they can influence policy that physicians or anyone else feel strongly about, the best way to support is to advocate through appropriate channels, through individuals who are representatives that can actually influence how individuals like Dr. Murthy are actually selected and approved for positions when nominated to leadership positions like this. And they can also advocate through their organizations, through their membership organizations, who have, as with the American College of Physicians, they have very strong advocacy groups and advocacy offices who do their homework, who provide evidence-based responses and act as a resource to legislators and administrators in government who are making these decisions. Making their voice heard in a balanced, objective way, I think, is the most appropriate way to do that.
Some experts at the Annals of Internal Medicine have tried to get to speak out in their journal and have been slow to come forward as they're worried that funds for their unrelated research would dry up if they advocate for gun control. Could this suggest that First Amendment rights are also in jeopardy over this issue?
You know, it's very hard for me to speak to that. While conducting this literature review, the college did identify significant gaps in the data where more evidence would be useful to guide policy on firearm violence. There have been several congressional efforts starting from the 1990s into 2011, where there's limited federal research on firearm violence, which greatly reduces the availability of data for us to be able to make an informed decision about these kinds of issues. You know, it's hard. I can understand why those doing this kind of research might be concerned that funding would be in jeopardy for this. We certainly have no evidence that would be the case, no strong evidence. The CDC has been charged by President Obama to reduce firearm violence and to do research in this area and the causes and the prevention of firearm violence. And CDC has also asked the Institute of Medicine and the National Research Council to identify the most pressing research needs for the public health aspects of firearm violence. In the IOM report, the Institute of Medicine report, in June of 2013, they gave a recommendation that research should focus on 5 high-priority areas, which are characteristics of firearm violence, the risk of protective factors, prevention and other interventions, firearm safety technology, and the influence of video games and other media on perhaps causing more intentional actions that relate to violence. The college really does support this, and we feel that there needs to be more funding that would go to the CDC, National Institutes of Health, and other funding agencies, other funded agencies who are going to do research on this. Whether individuals who are doing this kind of research feel comfortable in advocating for changes in laws and advocating for stronger policies that would protect the public from firearms violence, I think is hard to say. It's going to be sort of very individually based, of course. I would like to think that those agencies that are doing this kind of research are fairly protected from that kind of bias, but politics oftentimes wins out in these situations. We also have to be very concerned about conflicts of interest when personal opinion is expressed in a political way, when there is funding that's coming from particular agencies that are going to be influenced by the research that's actually being done. So I can understand why that concern might be there. What I have found is that, and what we have noticed is that when good research is being generated, that oftentimes the data actually trumps any reactive response that might occur, because it's very difficult to refute sound, objective data that's generated.
Certainly, one only has to look back at the Port Arthur, Tasmanian massacre in April of 1996 in Australia. 20 people are killed in 90 seconds. Within 12 days, Australia has a bill in place. I think it's something that our government and our research institutions have to look at. I think, in closing, it is probably time for pro-gun safety to move forward to reduce the tolls of death that since Robert Kennedy's death exceeds all American deaths in wars from the Revolution to today. Dr. Fleming, thank you very much for joining us.
It's been my pleasure.
This is Dr. Maurice Pickard. If you've missed any of this discussion, please visit ReachMD.com to download the podcast, and many others in this series. Thank you for listening.